Hello.
How are you today?
Doing good. How are you?
Good. My name is Sarah. I'm a student physical therapist. I'm going to be treating you today, okay?
Awesome.
I see on your chart you have John here. Is that okay to
Yep.
call you by? Perfect. All right, John. Explain to me a little bit about what's going on with you.
So I'm feeling very dizzy,
Okay.
and it happens when I bend over to pick things up, like toys off the ground.
Okay.
I'm gardening all the time.
Okay. And how long ago did this start?
A week ago?
A week ago. Okay. And can you explain your symptoms a little bit? You said dizziness. Is there any other way you would describe it without using that word?
Yeah, it kind of feels like my whole world is just spinning, and I can't not feel like I'm spinning.
Okay. And you said specifically when you kind of bend over?
Yeah.
When you bend over, do you bring your head with it?
Yep.
You do, okay. Okay. All right, so we're gonna do a couple things today. As of right now, just with some of your symptoms, I'm thinking what you have is something called BPPV.
Okay.
And that basically has to do with these little canals that are in your ear. So this is just like a little sculpture, kind of what's going on. It's kind of hard to think that this all fits in your ear, right?
Yeah.
So there's a bunch of different canals, and what happens is sometimes you have these crystals that are in this part right here, and sometimes they're supposed to stay in here, but that doesn't happen all the time.
Yeah.
So when we get spinning symptoms, it's usually because we have some of those crystals floating around in these canals.
Okay.
And as physical therapists, we actually have a very unique part in this, is that we can do different tests to figure out what canal it is, and then we can also do different treatments to clear the crystals. And specifically with BPPV, we can clear the crystal sometimes in one treatment.
Okay.
So hopefully today we can find out what canal you have going on. First, just to see, if you even have it at all, but that's my hypothesis at this point. And then we can hopefully see what canal it is and then go right into treatment.
Awesome.
And then hopefully we can get some of your symptoms to subside, okay?
That'd be fantastic.
Good. Okay, do you have any questions about any of that?
Not so far.
Not so far, okay. All right, so before we get started or do anything, I just want to ask you a couple questions just to make sure we're covering all our bases, okay?
Okay.
Do you have any history of blows to the head,
Nope.
trauma, concussions?
No.
How about headaches?
Your normal everyday headache every now and then.
Okay, nothing terrible that you had to go to the doctor for or anything?
Nah.
Have you had any of these symptoms before, the spinning?
No.
No, okay. How about any, are you on any IV antibiotics recently? No. All right. Any open wounds or anything?
Nope.
All right. Okay, so this should be a pretty quick procedure. I should have you done in a couple minutes here. Before we get started, I'm gonna get you up on the table, take your blood pressure. I see you have a history of high blood pressure.
Yeah.
We're gonna make sure that's all in check before we start bringing you up and down and,
Yes,
causing too many things. And then I'm also gonna make sure that your neck's moving pretty well, just to make sure, again, that I'm not gonna damage anything or something that I have to be aware of before we do things. And then I'm gonna also rule out something called vertebrobasilar insufficiency. And that's just sometimes BPPV, which is my hypothesis for you. Sometimes they have similar symptoms, but we can kind of rule that one out. And that's all just about your blood flow coming through your neck. So I'll just do a test really quick when I sit you up, just to make sure that we're clear there. And then we'll kind of look at the BPPV stuff, okay?
Sounds good.
All right. So let me just clean this table off really quick. Put my stuff down here. Alright, if you could sit up here for me, that'd be awesome.
Alrighty.
And as we're going through all this, if you have any major symptoms, you feel like nauseous, your symptoms get really, really high, you feel like you may pass out or something like that, I really want you to let me know.
Okay.
Just so we can avoid anything like that, okay? Yeah. Just gonna move the camera a little bit. All right. Take your blood pressure now.
Okay.
Any reason I can't take it on this arm right here?
Nope.
All right. Are you on blood pressure medication?
I am.
You are. And have you been taking that?
I have been.
Okay, good.
My
You've been on it
doctor-
for a while?
Yeah.
Okay.
My doctor says it's pretty important.
It is. I would have to agree with him or her. All right. I got 138 over 80.
Okay.
Is that about normal for you?
Yeah, it is.
Okay. All right. Okay. Now really quick, we're just gonna make sure that your neck's moving, okay, all right? So can you look up to the ceiling for me? Any pain there?
Nope.
Down, chin to the chest. Good. Can you look over your left shoulder? Good. And over your right. Can you bring your left ear to your left shoulder? Good. Come back, and then the opposite way. Good. Any pain with any of those?
Nope.
No history of any surgeries in your neck at all?
Nope.
Okay. All right, the next thing I'm going to do is I'm just going to make sure that that thing that I was talking about with the blood flow back here,
Yeah.
that we don't have any issues with that, okay?
Okay.
I'm just going to be moving your head. Please let me know if you have any symptoms that you're going to faint, pass out, you're feeling dizzy, nauseous, anything like that, okay?
Sounds good.
All right, are we ready?
Yeah.
All right. Okay, doing okay?
Yeah.
All right, we're going to go this way. All right, and one more direction. All right, go ahead and relax.
Okay.
All right, how you feeling so far? Doing all right?
Yeah, doing good so far.
Okay, so all that stuff came out perfect. Doesn't seem like you have any neck issues. Doesn't seem like you have a blood flow issue. So we're gonna go into seeing how you do with the BPPV tests. So if you could just swing your legs up onto the side there. Yep, and just kind of hang out there. I'm gonna move the camera for a second. Okay. All right, so what's gonna happen here is I'm gonna come behind you. I'm gonna tilt you one way. I'm gonna bring you back pretty quickly, okay?
Okay.
So I want you to trust me. I do have you. And we're gonna kind of stay back here for a little bit. I'm gonna kind of look at some of your eye movements. And then we're gonna come back up, okay?
Sounds good.
All right, go ahead and relax. I got your head. Ready?
Yep.
1, 2, 3. I'm seeing a little bit of some downbeating nystagmus. A little bit of torsion, no real direction. Any symptoms here, John?
Maybe a little bit.
A little bit? Going back up. Take your time sitting up. You scoot back a little bit for me?
Yeah.
Sure. Okay. Doing okay?
Yep.
All right. So I saw a little bit of some downbeating, which kind of points me to one of the canals. We're going to do the same thing, but on the other side, and see
Okay.
what we see there, okay? All right. Actually, scoot a little bit farther up. Like that way, yeah. Ready?
Yep.
Go in this direction. I got you, okay?
Yep.
Ready? 1, 2, 3. Same thing here. Downbeating nystagmus. No real direction. How are your symptoms, John?
Pretty good.
Pretty
I
good?
felt it a little bit, but it's going away.
It's going away. Sounds good.
Yeah, it's all gone now.
It's all gone. All right, we can go and sit back up. Take a second there, okay?
Okay.
All right, John. Now we're gonna go into treating. Now that we did all the testing, we found that it was that anterior canal. We're gonna go into treatment for it.
Okay.
So basically, it's kind of a simple test. It kind of sounds simple, but we're gonna have you just lay back on the table and kind of hang your head. It's gonna be at about 60 degrees,
Mm-hmm.
and we're gonna kind of wait there for 2 minutes.
Okay.
Okay. So really, what this does is we're just dumping those little crystals back to where they need to be.
Okay.
And it kind of takes about 2 minutes. We may have to do it a couple times, but we'll just start with one and see how it goes. Okay.
Sounds good.
All right. If you have any major symptoms as we're doing this, please let me know, okay?
Sounds good.
And I'll time the 2 minutes. Ready?
Yep.
1, 2, 3. Good. Go ahead and hang. Start my watch. Doing okay?
Yeah.
All right.
It's been a long day. Just a little tired.
Yeah. Tell me about it. Having any symptoms?
A little bit.
A little bit? Yeah, so basically all this is doing is it's just trying to get those crystals to move where they need to go
Okay.
in order for you to not feel like you're spinning all the time. And yes, 2 minutes is a very long time.
Yeah, I'm hoping this works. I can get on the floor and play with my grandkids.
Yeah, that'd be a lot of fun, huh?
Yeah.
How old are they?
6 and 8.
6 and 8. Boy or girl?
Yep.
Gotcha. Keep you moving?
Oh yeah.
Yeah? How often do you watch them?
2 or 3 times a week.
That's fun.
Yeah. I love them.
Yeah. It's always fun to play again. Alright, we got about 1 more minute. Just hanging out. 30 more seconds. See that snow squall today?
Yeah.
Crazy.
I'm from the Midwest originally, so I'm used to this.
Oh, gotcha. You're not scared of the snow.
No.
Alright, 2 minutes. I'm going to sit back up. Alright, so as I said, usually we do this a couple times. For time's sake today, we're just going to do 1. So I would normally do, 2 to 3 of these. This is also one that it's not always going to resolve super quickly.
Yep.
So you may have to come in 1 or 2 more times to do this a couple more times, and that's just because some of the crystals don't get all grouped together and they don't move together. So if
Gotcha.
you're still feeling some symptoms later, please call the office and let us know, and we'll kind of schedule another time to come in. We can kind of reassess the situation, okay?
Sounds good.
If you have any other crazy symptoms, not necessarily spinning, but anything that you feel off balance or dizzy, sometimes BPPV can cause other issues. So that's also something that we can treat here. Just want you to be aware of that, okay?
Sounds good.
All right, thanks for coming in.
Yep, thanks, Sarah.
Hi.
Hello.
Hi, John. Nice to see you again.
It's good to see you again as well, Sarah.
Do you remember me?
I do.
Okay.
How could I forget you?
I know. All right, so not so good to see you again, but good to see you again. Tell me a little bit about what's been going on with you recently.
So I'm feeling dizzy again,
Okay.
but it's not like the kind of dizzy that I had last time when I saw you.
Okay.
I feel a little bit more like lightheaded,
Okay, lightheaded.
and yeah, it feels like it's impacting my
Everyday life.
everyday life, everything I want to do.
Okay. Do you feel like when you move quickly, that's when it really is causing you the most problems?
Yeah. But when it comes on, it doesn't stay on for very long.
Okay.
It's very short lasting.
Okay. And the lightheadedness, is it all the time?
Mainly when I'm getting up and out of bed.
Right. Would you consider your description of dizziness to be lightheaded this
Yeah.
time rather than the spinning like before?
Correct.
Okay. All right. Okay. I already cleared you last time with any major blows to the head, any of that stuff, anything crazy that's happened to you
Nothing
since we
has
were last
changed.
together?
No.
Okay. All right. So we're gonna do a couple of tests here to kind of examine what I think may be going on. The first thing I want to do is I'm a little you have high blood pressure, correct?
Yes.
I just want to rule out orthostatic hypotension because you're feeling lightheaded. So all that really means is that, you know, when you change positions, sometimes your blood pressure drops.
Okay.
And that may be causing some of your lightheadedness. So I just want to look at that first just to make sure that that's not our main problem, because then we kind of would have to go a whole different route.
Okay.
But I'm going to take your blood pressure laying down, sitting up, and then standing.
Okay.
Just to make sure there's no crazy difference. And then we can kind of continue with some of our other exams, okay?
Okay.
All right. Let me look down the table. So let's first get you laying down with your head here. I'll take that from you. Thank you.
You're welcome.
Feeling lightheaded at all?
Nope.
All right. I'm gonna take it over here. All right. You're still taking your blood pressure medication, correct?
I am.
Okay, you can rest your arm.
Let's take a nap real quick.
Yeah, it's nice laying down, huh?
It is.
All right, just relax for me. I'm getting about 140 over 80. So at your own pace, can you sit up for me and take your feet and kind of dangle them off the side here? Good. Feeling okay?
Yeah.
All right, we're just going to take your blood pressure one more time. Have you been to your doctor recently?
It's been a few months,
Okay.
but
Okay. Seeing about the same thing. We this side. And then we're going to do it one more time with you standing up, if that's okay.
sure thing.
All right. Feeling okay?
Yeah.
All right. Just let me know if you start feeling dizzy at all. Just want to make sure that this isn't our main issue.
Yeah.
Wouldn't want to treat you for the wrong thing. Alright, and then we're getting the same thing, about 140. So it
Alrighty.
looks like that is not our main issue. You can actually take a seat in this chair.
Sounds good.
Okay, so I'm glad we ruled that out. So you know that your lightheadedness is not caused by orthostatic hypotension, which is good. I'm gonna next do what we call an oculomotor exam. So we're basically just looking at your eye movements, just to see if there's anything that we see there that could be abnormal.
Okay.
Okay? Alright. You can put this leg down for me.
Sorry.
Can you come a little bit closer? Alright. I'm just going to look at your eyes. I'm just going to hold your head. You stay right back at me. I'm looking for spontaneous nystagmus, which is just your eyes to move really fast in one direction, okay?
Okay.
Alright, go ahead. Alright. Good, go ahead and relax. No spontaneous nystagmus. Okay. the next thing I want you to do, I'm gonna move this pen in a pattern of an H,
Okay.
I want you to follow the tip of this pen with your eyes. Don't move your head, just move your eyes, okay?
Okay.
All right. Here I'm looking at Smooth Pursuits. Alright, and now I'm going to look at NGs.
Bless you.
Good, go ahead and relax. Nothing there. Alright, the next thing I want you to do, I'm going to take this pen, I'm going to move it closer to your nose,
Okay.
okay? And I just want you to tell me when it starts to get blurry or that two of these pens comes, okay?
Sounds good.
So you can see two of them, okay? Alright.
Right there.
Okay, that's within 3 to 4 inches, which is normal. That's negative. All right, the next thing I'm gonna do is I'm gonna thrust your head a little bit, okay? Nothing crazy. I cleared your cervical spine last time, nothing crazy going on with your head anymore?
Nope.
All right, so I just want you to relax and I want you to keep your eyes on my nose as we do this, okay? I'm gonna be moving your head, all right? Good. Nothing there. Good, nothing there. Put your head a little bit for me. Do a couple more. Good. Good. Okay. Feeling okay? Good. No nystagmus seen in the head thrust. All right. Can we do one more, okay?
Sure.
So I want you, I'm gonna be holding your head, I'm gonna be moving with you, and I want you to keep your gaze on my nose, okay?
Okay.
But I'm gonna be moving with you, okay?
Sounds good.
So you can imagine my nose?
Yeah.
I'm gonna tilt you down a little bit. Good. All right. And then I would do the head shake test if we had the goggles. However, we don't, so we are gonna hold off with that one. But everything else in the oculomotor exam was negative, so I didn't see any central signs, so I'm gonna continue. All right, how are you feeling?
Good.
Good? All right. So I'm thinking that part of your symptoms, what's really pointing me to what I think is going on is the lightheadedness that you're having, and there's nothing really in your ocular exam when we looked at your eyes that made me think that anything was really wrong.
Okay.
So I'm thinking that you may have a little bit of motion sensitivity, and this may also have a visual component. So, so I think that like with your vision, when you have your eyes open, you're moving around, you're doing a bunch of stuff, that it's causing you to get a little nauseous.
Mm-hmm.
Is that true?
Yeah, it is.
That happens? Okay, so I'm thinking that we're going to do a little test here, the MSQ, which is going to tell me certain positions and certain movements that you make to see if you have symptoms, number one, how intense they are, and then it's also going to tell me how long your symptoms last. So if we do a movement, and we're going to count how many seconds it takes for you to get back to your normal.
Okay.
Okay? All right. So if you could come and sit up right here for me, that'd be awesome. All right. So the first one we're going to do is I'm going to have you go from sitting like this to laying on your back, okay?
Okay.
Whenever you're ready.
Alrighty.
Good. Any symptoms?
A little bit.
Okay, so we're going to go on a scale from 0 to 5.
Okay.
0 being no symptoms, 5 being very intense. How would you rate this?
1.
A 1. Okay. And are your symptoms still there?
Nope.
Okay. All right. So every time we do different positions, I want you to tell me intensity from 0 to 5. And then I'm going to count how many seconds it takes, and you tell me when you have no symptoms anymore.
Sounds good.
All right? So can you go and turn on to your left side for me? Good?
Yeah.
How we feeling, 0 to 5?
1 and it was gone basically right away, like 1 second.
Okay. Can you go back onto your back for me?
Yeah.
All right. All right, can you roll onto your right side for me? Good.
It was like a 1 again in like 1 second.
Okay, go back onto your back for me. So nothing crazy so far.
Nope.
Okay. Now, can you come back sitting up for me? Good. How was that one?
It was a little more intense, like a 2,
A 2? Okay.
but it was only for 1 second again.
Okay. All right. We're gonna put your legs back on the table. Remember when we did that testing before?
Yeah, last time I saw you?
Yeah. All right. So we're just gonna test a couple things here. And can you scoot a little bit back towards me? Perfect. All right. So I'm gonna bring you back into one of those positions again. You're gonna tell me how your symptoms are. Okay? Ready?
Yep.
1, 2, 3.
It was like a 2,
Okay,
and it
let
took
me
2
know.
seconds.
Okay. Go ahead and sit back up for me. 2 for 2 seconds.
Yep.
And how about sitting up?
It was a much more intense, like a 3, but it was gone faster.
Okay. So
1
you had
second.
more of a trouble coming up.
Yeah.
Okay. All right, we're gonna do the same thing, but we're gonna go to the opposite direction, okay?
Okay.
All right, return your head this way and up. Ready, 1, 2, 3.
Yeah, it was like a 2 on the scale, 2
Mhm.
seconds.
They're gone already?
Yep, it's gone.
All right, now we're gonna sit back up. How about that motion?
Similar to getting up on the left, a 3, and it's
Okay.
already gone.
All right. So not feeling too many symptoms yet?
Nope.
Okay. All right. Can you go ahead and sit this way with your legs off the table?
Yeah.
All right, so what I want you to do is when you're sitting here, I want to take your head and I want you to tip it down towards your left knee.
Okay.
So go ahead. Hold it there for a second. How are we feeling?
That's the worst it's been.
Oh, yeah?
Yeah, it's
What's
a
your
5.
number? Okay, a 5.
It's gone now though.
Okay, can you sit back up for me? And how about this one?
Again, it jumped up pretty high. Not
Mhm.
as high. That was a 4,
Mm-hmm.
but in like 2 seconds.
Okay, 4 and 2 seconds. All right, we're gonna do the same thing to your right knee.
Okay.
Go ahead.
Oh, wow.
Yeah, you feeling that one?
Yeah, it's just like the left knee. It's a 5 again.
Okay, and back up.
Oh yeah, just like the other side again. 4.
4. Okay. And how long does that take to go away?
3 seconds going down and 2 seconds coming up.
Okay. All right. So, you still feeling okay?
Yeah.
No symptoms?
Not now.
Okay. So I want you to sit there and we're gonna do head turns next.
Okay.
Okay, so we're gonna do it 5 times. So here and back is once.
Here and back is once.
Yeah.
Okay.
Once you get back to that side as well.
Okay.
Ready? Go ahead. 1, 2, 3, 4, 5. How was that one?
That was pretty bad too. It was
Pretty
a 5
bad.
again.
Okay. Taking a little bit longer. How are we doing getting back?
Yeah, it took a little longer. 3 seconds.
3 seconds. Okay. All right. The next one I want you to do is we're kind of turn our head here and here, and we're gonna do it 5 times.
Okay.
Go ahead. 1, 2, 3, 4, 5.
Yeah, it was pretty, not as bad. It was a 3.
A 3. Okay.
And it took like 2 seconds, and then it was gone.
All right. All right. Can you stand on up for me?
Yeah.
All your symptoms are gone, right?
Yep, they're all
You
gone.
let me know if they're not gone yet.
I can
okay?
do that.
All right. So what we're gonna do is we're gonna spin all the way around so you're facing that way.
Okay.
Go ahead. Turn towards me. Good. How you feeling?
Pretty good. The
Pretty
symptoms
good?
are there, like 3, not 3 though.
Okay. And then we're gonna spin back this way towards me.
It was the same.
Out of 3.
3.
Okay. Go ahead. Sit back up on the table for me. How long did that one take to go away?
1 second each way.
1 second each way. Okay. All right. So what I'm seeing here from what we got from this is that it seems like you are a little motion sensitive, especially with, it kind of aligns with what you told me when you
Okay.
came in. You said that quick head movements sometimes really make you dizzy and lightheaded.
Mhm.
So it seems like you turning your head fast gives you some problems.
Yeah.
And it seems like anything that you do where you're kind of coming back down and back up gives you some problems. And
Yeah.
it seems like you're a little bit worse on the way up than you are on the way down.
Mhm.
Okay? So from these results, we can kind of build you a treatment program.
Okay.
And from that, we can do some exercises and kind of get you on your way to feeling better.
Okay.
And hopefully we can decrease some of your motion sensitivity, okay?
Awesome.
All right, so I'll let you sit here for a couple minutes, let your symptoms come down, and then I'll come back and we'll do some exercises, okay?
Sounds good.
All right, cool. All right, John, so now that we did all your testing, we're ready to get into some exercises, okay?
Okay.
Before we get into anything, can you tell me where your symptoms are right now on a scale of 0 to 10?
Like a 4.
Like a 4?
Yeah.
Okay, exams got you going a little bit?
Yeah, a little bit.
Okay, so I just want to talk a little bit before we get into it, kind of what our plan is. So you're at a 4 out of 10 right now. When you come in at treatment, I'm going to ask you in the beginning of our treatments and say, you know, what number are you at?
Okay.
The purpose of that is because I don't want you going too high, where our symptoms get to the point where like you're so dizzy, so lightheaded that we can't do anything.
Okay.
However, we do want you to push yourself and get into some of those, like if you're starting at a 4, today we're not going to let you go past a 7. We don't really even want you to hit a 7. Let's say like 4, 5, 6.
Gotcha.
The reason for that is we need to push into the symptoms, especially with motion sensitivity, in order to desensitize you and get these certain motions that you're having increased symptoms with to be kind of normal for you and that you don't get them anymore.
Okay.
So for today, when we're doing them, I'm going to continuously ask you, where are you at? And you kind of should know that that's, you know, your cue to give me a number, okay?
Sounds good.
I am, once you get up, like so let's say you get up to a 6, we are going to take a break. In between your exercises, we'll let you get back down to that 4, and then we'll do the next exercise, okay?
Sounds good.
Last thing, before you leave today, I'm going to give you a home exercise program. Especially with motion sensitivity, using the outside world is honestly really easy. So a couple things that I'm going to give you is you can just kind of sit and you can watch cars go by and you can track them.
Okay.
I'm going to print this all out on a sheet. There's a bunch of different things that you can do, as well as some of the stuff that we're going to do here today that you can do at home. You're not going to be in here every day, but it's important that we're still pushing you every day to make sure that we're, you know, getting the symptoms to come down quickly.
Yeah.
And that you're not here at therapy, you know, forever, okay?
Yeah.
So, before we start, I'm gonna put this gait belt on you, just for kind of your safety in mind. Our first activity is gonna be seated, and then we're gonna kind of get up. So, just want to be prepared, okay?
Sounds good.
All right, can you lean forward for me? Perfect. And again, at any point in time, if you're feeling, it's okay. If you're feeling any symptoms, just let me know, okay?
Sounds good.
Is that okay?
Yeah.
All right. So the first thing that we're going to do, we're kind of basing some of our treatment off of how you did on that test that we did earlier today, okay? So the first thing I want you to do is I just want you to sit there. I want you to turn your head. Not super fast, not super slow, at a good pace. And we're going to try to do it for 30 seconds, just seated, because we had trouble with that in your exam, okay?
Yeah.
All right, whenever you're ready, go ahead.
Is that fast enough?
Yep, that's perfect. Feeling okay?
Yeah.
All right, keep it going. We're going to go for like 20, 30 seconds. All right, go ahead and stop. How are we feeling?
They turned it on a little bit. About a 5.
About a 5, okay. Let's wait a couple seconds until you're back down at that 4. You let me know.
Yeah, we're good now.
You're good now?
Yeah.
Okay, we're going to do that 2 more times. Go ahead. So this is also one very easy to do at home. Very safe. You're nice and seated,
Yeah.
right? 10 more seconds. All right, go ahead and relax. Where's our number?
Still a 5 again.
A 5 again. Okay.
It's not bad.
All right.
It's already coming down.
Okay. So it seems like you didn't have major problems with that. So we're going to do the same thing, but we're going to be in standing, okay?
Okay.
All right, so go ahead and stand up for me. And on me right here, I'm just going to hold on to you just in case you start feeling anything or you start losing your balance, okay?
Sounds good.
Whenever you're ready, I'm timing you.
Thunder.
A lot going on.
Busy place.
Keep it up. All right. Feeling okay?
Yeah.
Need to sit down or are you okay standing?
I'm okay.
All right. What number are we at with this one?
5 again.
A 5 again?
That's
Okay.
coming down pretty quick.
Good.
Quick.
All right, we're gonna do this one more time.
Alrighty.
Whenever you're ready. Good work. Keep it up, John. All right, go ahead and stop. Doing okay?
Yep.
What were symptoms?
5 again.
Okay. Once they get down to a 4, we're gonna sit you back down.
We can sit down anytime.
Oh, okay. All right.
Take
So,
a load off.
the last progression for this exercise is I saw in your form that you filled out that you're having trouble getting up and down out of a chair on your own, just mostly by your strength. So we're going to do 5 head turns, then we're gonna stand up, and we're gonna do 5 head turns.
Okay.
Okay? And we're gonna do a couple of them. I just want to work in to make it a little more functional for you. So we're also working on strength as we're working on your motion sickness at the same time, okay?
Sounds good.
Again, I'll be standing here holding on to you. So 5 head shakes, standing up, 5 head shakes, and then sitting back down.
Are they all horizontal?
But we're just gonna do, yep,
Okay,
back
just wanted
and
to make
forth.
sure.
Yep.
Okay.
Ready?
Yep.
Go ahead.
1, 2, 3, 4, 5.
Yep, stand nose over toes. Good.
1, 2, 3, 4, 5.
And come back down. Good. How'd that feel?
Good.
Did you feel okay getting up? Still a little bit of an issue?
A little weak still, and it was more challenging with the head twist.
Right,
but-
of course. Just one thing, when you're getting up, let's make sure you lean over and we call it nose over toes.
Okay.
So you're really pushing, and then you can bring your feet back a little bit closer into the chair to make it a little easier for you to get up.
Okay.
All right, we're gonna do this one 2 more times.
Alrighty.
Here we go. 5 head turns. Into the sit position. Good. 5 head turns. And sit back down. Doing okay?
Yeah.
How about where are our symptoms at with that one?
5.
5, okay. We're gonna do it one more time whenever your symptoms get back down to that baseline.
Alrighty.
Ready? Cool. Stand back up. Okay. Sit back down. Good. So next time we also may add some different head movements. I'm going to show you those right now in a walking exercise we're going to do, okay?
Cool.
So symptoms back down to a 4 yet?
Yep.
All right. So what we're going to do next is we're going to do walking with different head turns, okay? So we're going to do this from down here all the way to this desk here. We're going to do one motion, and then we're going to do it back, and we're going to do a different motion, and back, and then we're doing 3 different head motions, okay?
Sounds good.
I'm going to be next to you the whole time. Again, let me know if you have any increasing of symptoms, and I'm going to ask you after every pass how you're feeling, okay?
Sounds good.
All right. Whenever you're ready, nose over toes. Good. We're going to start over here.
Yeah.
All right, turn this way. All right, so the first one we're going to do is you're going to shake your head back and forth just like we were doing seated,
Okay.
okay? To that desk. Good. We're going to turn around. That way, yep. And the same thing back. Good. Go ahead and turn around. Okay, now this time we're going to go up and down with our head movements,
Okay.
like you're nodding, okay? Go ahead. Pause. How are we feeling? What's our number?
5.
5. Okay, coming on back. Good. Okay, we're gonna do one more motion. This one may cause you a little bit more symptoms just because on our test we kind of saw that this one kind of gave you the most trouble, okay?
All right.
So I want you to kind of do head nods in diagonals. So on the way there, I want you to go up right to down left the whole time.
Okay.
Okay, are we ready?
Yep.
Go ahead. Take your time. Yeah, good. How are you feeling with that one?
More challenging for sure.
Okay, all right, let's turn. Let's go the other way back. So upper left to bottom right. Go ahead. Good. Okay, how was that?
Definitely more challenging,
Okay.
but not bad.
Still out of 5?
5, 5.5.
Okay, we're gonna go sit back down in this chair here for me. Good. Okay. So next, what we're gonna do is there's a specific motion that you were doing where you were bringing our knee down and coming back up.
Yeah.
Okay. So we're gonna work on that a little bit. That one you had a 5 out of 5 for your intensity.
Yeah.
So we want to work on that, and the more we go into that motion, the less the symptoms should get. Okay.
Okay.
So today, what I want you to do right now, we're gonna add in a little bit of foot motion too. Okay. I see that you're having trouble bringing those toes up to the ceiling.
Yeah.
So what I want you to do, is when you come down, you're leaving your feet. When you're coming back up, I want you to bring your toes up with you.
Okay.
Okay, you think you can do that?
Yeah.
Let's go to our left knee first. Yep, and then come back up, bring your toes up. Good, and down. We're gonna do it 5 times, okay? 2, 3, 4, 5. How's that feeling?
Challenging, but
Okay.
manageable.
Still out of 5, 5.5?
Yeah.
All right, let's do 5 to the opposite knee. Yep, bring those toes up and back down. Toes up and back down. 4, 1 more. 5. Still out of 5?
Yeah.
Okay. All right. So for progression for that one, we would move him into standing, and we would do the same thing with the toes as well, trying to get up on the heels and then up on the toes to try to add in that functional component. Okay, the last exercise we're gonna do, we're gonna be standing, not yet, standing. We're gonna do the same type of a movement. You're coming down and back up, and we're gonna get a ball toss, okay?
Okay.
I have my lovely assistant Dana, who's gonna help me with this.
Hi, Dana.
All right, so I'm gonna stand here next to you. Let's stand on up. Good mechanics, good. So what I want you to do first is we're gonna take our knee to our left, or our head to our left knee, come back up, and then you're gonna catch a pass, okay?
Okay, doke.
Go ahead. Good. Nice. Let's do 5 of them. 2, 3, 4. 1 more. 5. Good. How's that feel?
Good.
All right, I'm gonna switch sides. We're gonna go the other way, okay?
That's probably the most challenging one yet, though.
Yeah, it's supposed to be.
Yeah.
The end of the treatment, right?
Best for last.
All right, same thing. You're coming down this way. 1, 2.
You're going
3.
places, Dana. You're going to the NBA.
4 and 5. Good. How are we feeling?
Good.
Good?
Like a 6.
Like a 6, we're getting up there?
Yeah.
All right, go ahead and sit back down for me. All right, John, so that's going to be the end of our treatment for today. Because we did examination today, we didn't get to as many exercises, but those I think are pretty good to start with for now. I'm going to give you the sheet right here of exercises that you can do at home when you're not here.
Okay.
And I think that as we keep pushing into those symptoms, that we're going to be able to really help your motion sensitivity and really help with that dizziness that you're experiencing, okay? Do you have any questions for me?
No?
No? Okay, so I'll see you next treatment and we'll kind of get into more exercises and keep challenging you, okay?
Sounds good.
All right,
Thanks,
have a
Sarah.
good one, John.
Yep, see ya.